Welcome to Module 3, Introduction to Medical Terminology and Anatomy. In this module, we will review word elements such as combining forms, prefixes, and suffixes. We will also look at diagnostic and procedural terms and interpret their meanings. And then we will also understand anatomy as it relates to coding. This is a review of anatomy and medical terms that you should already know, and this is not meant to replace a comprehensive course in medical terminology or anatomy. Every profession has its own language, and medicine is no exception. Medical terminology is an ancient language that has been in use for many years. For example, we often see PRN within medical documentation. PRN stands for the Latin phrase pro rata, which means when necessary. To code medical procedures and diagnoses accurately, you must first know the language of medicine. The base of a word is considered the root. These are terms that are the main portion of a medical term, and a root word often defines the body area or system that is being discussed, such as derm for skin or splen for spleen. It is possible for a word to have multiple roots, which is referred to as a compound word. An example of a compound word will be cardiovascular. Cardio means heart, vasculo means vessel. Cardiovascular is pertaining to the heart and blood vessels. Another example is nephrolithiasis. Nephro is the kidney, and lith is the calculus or stone. Therefore, nephrolithiasis is a disorder that is characterized by stones in the kidney. A prefix is attached at the beginning of a word. It typically indicates location, time, or number, although a prefix can also give other definitions to words such as color. An example of a prefix indicating a number is tri, meaning 3. The tricuspid valve has 3 points or cusps. An example of a prefix indicating color is cyan, which means blue. So cyanosis is a bluish color of the skin, which indicates a lack of oxygen. A suffix is attached to the end of a word. Suffixes frequently indicate a procedure, condition, disorder, or disease. So an example of a suffix indicating a procedure is ectomy, which means excision or surgical removal. A mastectomy is the surgical removal of a breast. An example of a suffix indicating a disorder is itis for inflammation. So pericarditis is inflammation of the pericardium, which is the fluid sac that surrounds the heart. Knowledge of medical terminology is required to understand the documentation that you will be interpreting into codes. Over the next few slides, you will find some common prefixes and suffixes. We will discuss the word roots that pertain to each body system with that appropriate body system. I have attached a document as well within the course that contains the most used prefixes, suffixes, and word roots. It may be beneficial to purchase a medical dictionary if you are new to the field in order to reference when learning to code. The next few slides will not have any audio, but the slides are available for your reference. Often, you will hear the terms anatomy and physiology used together. Anatomy refers to the structure of the body parts and their relationship to one another. Physiology will refer to the function of the body and how those body parts work to carry out their life-sustaining activities. In this module, we will be discussing anatomy. The human body contains multiple organ systems, and an organ is multiple tissue types that are formed together to perform a specific function for the body. An example of an organ would be the heart. An organ system is a collection of body parts that depend on one another in order to achieve a mutual objective. An example of an organ system is your cardiovascular system, where the heart and the blood vessels work together in order to carry blood and oxygen to all of the body cells. The organ systems is what makes up the human body. So, in this module, we will discuss a brief overview of the organ systems. Healthcare personnel will use a standard form for body directions and orientations. The standard body is considered the anatomical position. So, the anatomical position is an upright, face forward position with the arms by the side and the palms facing forward. The feet are parallel and slightly apart. This position is used when talking about directional terms in your medical documentation. In this medical documentation, it states that the resection was from the superior portion, which is towards the head, down to the inferior portion, which is towards the feet. Understanding directional terms will help when interpreting medical record documentation. The integumentary system consists of the skin, hair, and nails. There are only a few procedures pertaining to the hair, so we will focus mostly on the skin and the nails. These structures work together to provide protection from injury, fluid loss, and outside elements such as bacteria and viruses. They also provide body temperature regulation, fluid balance, and sensation. In the CPT manual, the breasts are also included in the integumentary system chapter. Understanding the layers of the skin is important, as depth is one of the concepts that applies when coding from the integumentary system. The epidermis is a top layer of skin made up of 4 to 5 layers, and its main job is protection. The dermis is the mid layer of the skin just below the epidermis, and it is comprised of blood vessels, connective tissues, nerves, lymph vessels, sweat glands, and hair shafts. And then your subcutaneous tissue is found just below the dermis. While it is not technically a layer of skin, it lies just beneath the skin, and it is made up of connective tissue and adipose tissue. Some codes are selected based on the depth of the procedure. So an example is skin debridement. CPT code 11042 is for debridement of the subcutaneous tissue. There is a parenthetical instruction underneath 11042 directing the coder to look at codes 97597 and 97598 if your debridement only involves the dermis and the epidermis layers. The nail is made up of 6 parts. The root is the part that extends into the skin. The nail bed is the area that the nail lays on. It extends from the lunula to the hyponychium. This is the pink part of your nail, which gets its color from the blood vessels, nerves, and melanocytes. The nail plate is the actual nail made of translucent keratin. The eponychium is the cuticle, and the perinychium is the skin around the nail and is the site of hangnails, ingrown nails, and infection of the skin around the nails called perinychia. The hyponychium is the junction between the free edge of the nail and the skin. So a term that you'll want to be familiar with is subungual. Subungual means under the nail. So evacuation of a subungual hematoma is coded with CPT code 11740. The musculoskeletal system is made up of primarily bones and muscles. It includes the joints, tendons, and ligaments. The bones will form the skeleton, which supports the body, and it provides a mechanism for motion and it protects vital organs. The bones also serve as a production factory for blood cells and stores calcium, phosphorus, and magnesium salts. The muscles will provide form and heat for the body. Bones can be classified according to their shape. Long bones are longer than they are wide, and they are found in the limbs, such as the femur and the humerus. Short or cuboidal bones are shaped like a cube. Examples of short bones will include the carpal bones of the wrist and then the tarsal bones of the ankle. Sesamoid bones are shaped like a sesame seed, and they can be found embedded in tendons within the joints. There are 2 sesamoid bones in the ball of the foot underneath the big toe joint. And then the patella within the knee is the largest sesamoid bone. Flat bones have a layer of spongy bone between 2 thin layers of compact bone. The cross section is flat and not rounded. The skull and ribs are examples of flat bones. And then your irregular bones are the bones that do not fit into any of the other categories of bones. Vertebrae will have their own shape, and they are considered irregular bones. Cartilage is a type of flexible connective tissue that is non-vascular, meaning that it has no blood vessels. Cartilage is a matrix made of chondrocytes, collagen, and cells called proteoglycans. Joints and articulating surfaces are synonymous, and they will provide a connection between two or more parts of the skeleton. Joints are going to be classified according to the type of connective tissue at the articulating surfaces. The three types of joints are fibrous, cartilaginous, and synovial. Most of your joints will be considered synovial. The human skeleton is divided into two parts, the axial skeleton and the appendicular skeleton. The axial skeleton will contain the skull, spine, ribs, sternum, and sacrum, and it protects your vital organs. The appendicular skeleton will be your extremities and then the girdles that connect them. Muscles have the property of contractility. They also provide form and then produce heat for the body. There are three different types of muscle. You have skeletal, it's also known as striated, and these muscles will move the skeleton. They are attached to the skeleton by tendons. And then your cardiac muscle is your heart muscle. It is an involuntary muscle that pumps blood through the body. And then lastly, your smooth muscle is found in the walls of your hollow organs of the body, like the esophagus, and they will move food through, as well as your bladder to control urine flow, and then even your eyes. The cardiovascular system is made up of the heart and the blood vessels. The heart pumps to move blood throughout the body, throughout the pulmonary circulation and systemic circulation. The heart is composed of three layers: the epicardium, which is the outer lining, the myocardium, which is the main heart muscle, and then the endocardium, which is the inner lining. The muscles of the heart sit in a fluid-filled sac called the pericardial sac. A pericardial window, described in CPT code 33025, is an incision made in the pericardium to drain fluid that has built up around the heart. There are three types of blood vessels. The arteries will take blood away from the heart. The veins will take that blood back to the heart. And then capillaries are tiny, semi-permeable vessels that facilitate the exchange of fluid, oxygen, nutrients, and waste between local tissues and the bloodstream. Coronary artery bypass grafts or cabbages can be created using veins or arteries. Next, we're going to follow the blood as it moves through the heart and the body. Keep in mind that these processes will all happen at the same time throughout the body, but for the sake of discussion, we will walk through it one step at a time. Deoxygenated blood will enter the right atrium from the body through the large vessels, the superior and inferior vena cava. During diastole, blood will flow down from the right atrium through the tricuspid valve into the right ventricle. During systole, the heart contracts and the blood is pushed from the right ventricle through the pulmonary valve into the pulmonary artery. Deoxygenated blood will then flow through the pulmonary artery away from the heart and to the lungs, where your gas exchange will occur. Oxygenated blood is picked up and then returned to the heart through the pulmonary vein. Oxygenated blood will then enter into the left atrium from the pulmonary vein. And during diastole, blood will flow down from the left atrium through the mitral valve, also known as the bicuspid valve, into the left ventricle. During systole, the heart contracts and blood is forced from the left ventricle through the aortic valve and into the aorta. From the aorta, blood is pushed into arteries and carries oxygen blood through the body, and it drops off the oxygenated blood and then picks up deoxygenated blood, which is then returned to the heart by the veins. The heart contains an electrical conduction system. The conduction begins at the sinoatrial node of the right atrium, and the sinoatrial node is also known as nature's pacemaker, as it sets the pace for the heart. Electrical impulses will go from the sinoatrial or the SA node to the atrioventricular or AV node, and then down along the septum via the bundle of His. From the bundle of His, the electrical impulse will move across the bottom of the heart via the Purkinje fibers. And the Purkinje fibers are tiny signaling devices within the electrical system along the ventricle at the apex. Electrical signals will cause the right and left atria to contract at the same time, and this is followed by contraction of the ventricles, also known as your systole. There are 5 circulation systems within the body. 2 of them will be talked about here. One is the pulmonary circulation system, which pushes blood from the right ventricle through the pulmonary valve, out the pulmonary artery in order to take deoxygenated blood to the lungs in order to drop off your carbon dioxide and pick up oxygen. Blood is then returned to the heart through the pulmonary vein, and it returns oxygenated blood to the left atrium. The systemic circulation is the next phase of blood circulation when the oxygenated blood flows from the left atrium to the left ventricle. It then moves from the left ventricle out through the aorta into the rest of the body. Like the cardiovascular system, the lymphatic system includes a network of vessels that transports fluids. The lymphatic system is important to our body's defense system and its resistance to diseases. The lymph vessels and nodes collect your excess fluid from the interstitial spaces, and it returns it to the heart using a series of valves. Lymphoid organs will include the spleen, thymus, tonsils, and Peyer's patches of the intestines. Respiration is critical to all cellular activity. The pathway of the respiratory system will begin with oxygenated air entering the nostrils. The air is filtered through the fine hairs and mucus to trap germs, fungi, and spores. The filtered air then travels through the larynx and into the trachea. The larynx, also known as the voice box, is a funnel-shaped organ in the back of the throat connecting to the inferior portion of the pharynx. It is formed by 9 rings of cartilage that are connected by muscles and ligament. The hyoid bone is not a part of the trachea, and it does not actually articulate with any other bone, but it provides attachment to the muscles of the floor of the mouth and the tongue above, the larynx below, and then the epiglottis and the pharynx behind. The primary function of the larynx is to protect the trachea when swallowing, as well as producing sound. The larynx is covered by the epiglottis when swallowing. The epiglottis is a flap of tissue that covers the larynx in order to protect the trachea from inhaled food or liquid. The larynx also contains your vocal cords. The trachea, or the windpipe, is a cartilage-supported tube that connects the nose and the mouth to the lungs. If the epiglottis fails to cover the larynx, food or liquid can then enter the trachea. The trachea will then branch into the left and the right bronchi. The ridge separating the opening of the bronchi is called the carina. It is a downward and backward projection of the last tracheal cartilage. The right and left bronchi are in the connection between the trachea and the lungs. The right bronchus is shorter and wider than the left. The right bronchus also branches into 3 bronchi, providing airways to the 3 lobes of the right lung. The left bronchus branches into 2 bronchi, and it goes to the 2 lobes of the left lung. The bronchi divide further into tertiary or segmental bronchi and then into smaller bronchioles. The bronchial system is often called the bronchial tree. These bronchioles will eventually branch into alveolar ducts and sacs, and then these sacs are the primary units for the exchange of oxygen and carbon dioxide within the lungs. The lungs are within the thoracic cavity on either side of the heart. The right lung is divided into 3 lobes, and the left is divided into 2 lobes. The individual lobes are divided further into segments and then lobules. The left lung is longer and narrower than the right due to the heart being in the left portion of the thoracic cavity. The right lung is shorter because the diaphragm is higher on the right in order to accommodate the liver that lies just below. The lungs are protected by the pleura, which is a serous membrane that folds back onto itself to form a two-layered structure. The space between the two pleural layers is known as the pleural cavity. This cavity contains pleural fluid that prevents friction between the two membranes, and it allows them to slide past one another during breathing, as the lungs expand and as they contract. The outer layer of the pleura attaches the lungs to the chest wall, and then the inner pleura covers the lungs. The digestive system is a feeding tube that begins in the mouth and ends at the anus. The structure winds its way through several body cavities. It encompasses a multitude of structures and organs that mechanically and chemically break down food for absorption into the bloodstream and for use at the cellular level. The esophagus joins the stomach at the cardiac orifice. The fundus of the stomach is the rounded upper portion of the stomach, and the body, which is the main portion, and then the pyloric antrum, which is the lower portion of the stomach. The small intestine is divided into three sections. The first 1/3 of the small intestine is known as the duodenum. The second 1/3 is the jejunum, and then the distal 1/3 is the ileum. There is also an ileum in the pelvis bone. To easily remember which ileum is in the small intestine, remember all three sections of the small intestine are spelled with an E. The large intestine begins just after the ileocecal valve at the cecum, with the appendix attached at the bottom. Then the colon, the rectum, and the anal canal. There are four portions of the colon. The ascending colon proceeds from the ileocecal valve upward to the hepatic flexure. It then becomes the transverse colon, and then turns downward to become the descending colon at the splenic flexure. The descending colon gives way to the sigmoid colon, and then it ends at the rectum. The internal and external anal sphincters at the terminus of the rectum will control the flow of fecal matter leaving the body. When coding for endoscopies of the large intestines, it is important to know the extent of the large intestine that is examined. The endoscopy begins at the rectum. For a proctosigmoidoscopy, the examination goes into the sigmoid colon. For a sigmoidoscopy, the examination goes through the sigmoid colon and possibly into a portion of the descending colon. And then for a colonoscopy, the entire colon is examined. The urinary system consists of 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. Kidneys are important excretory organs. They eliminate urea, which is the chief end product of nitrogen metabolism that is formed by the liver. Besides excess water, electrolytes, waste, including toxins and drugs, are eliminated from the body via the urinary system. Kidneys will serve a vital role in regulating the excretion of water and electrolytes, maintaining the normal volume and composition of bodily fluids. Kidneys will also play a major role in regulation of acid-base balance, regulation of blood pressure, and regulation of red blood cell production. Blood enters the kidneys from the renal arteries through the renal pelvis area of the kidney, immediately breaking up into many small branches ending in capillaries. This functional unit of the kidney is the nephron, where materials are reabsorbed, urine is made and channeled into collecting tubules, emptying into calyces, which will then empty into the renal pelvis of the kidney. Ureters carry urine to be collected into the urinary bladder for temporary storage until it is eliminated through the urethra to the outside. Under normal conditions, the bladder holds up to 500 cc's of urine, and under abnormal conditions, much more than this. The central organ of the female reproductive system is the uterus. It is comprised of 2 primary components, the cervix uteri and the corpus uteri. The cervix uteri, also known as the neck of the uterus, is the lower portion of the uterus tapering to connect to the vagina. The fornix refer to the anterior and posterior recesses of the upper vagina surrounding the vaginal attachment to the cervix. The opening is the cervix, and that is also known as the os, or the external os. The fundus, or the body of the uterus, is known as the corpus uteri. This is the part of the uterus where the fetus develops during pregnancy. You have two fallopian tubes that lead from the bilateral ovaries into the uterus. They are also called oviducts. Uterine tubes, and salpinges. The distal ends of the fallopian tubes are called the infundibulum. The fimbriae near the ovaries will capture the eggs at ovulation as they make their way into the tubes and into the uterus. The ovaries are the actual egg-forming reproductive organs, and they also produce hormones related to the female reproductive cycles, making them part of both the female reproductive and endocrine systems. The vagina is a tubular, muscular canal leading from the uterus to the outside of the body. The top of the vagina surrounds the cervix. The distal vagina opens to the vulva and the perineum. Occasionally, the vagina will contain a congenital partition or a vaginal septum. This septum can either be longitudinal, essentially creating a double vagina, or transverse. A transverse septum may block menstrual flow, or if it's incomplete, it may cause pain during intercourse or could even obstruct delivery. The vulva is the external organ of the female. It contains structures including the labia majora and minora, the mons pubis, clitoris, and the introitus, or the vestibule of the vagina. The introitus is also known as the location of the hymen, which is a fold of mucous membrane surrounding or partially covering the external vaginal opening. Several glands are also found in the vulva. You have your Bartholin's glands that are located slightly inferior into either side of the vaginal introitus. Your Skene's glands are located on the anterior wall of the vagina around the lower end of the urethra. The perineum is the area between the pubic symphysis and the coccyx, between the legs. This word can refer to only the superficial structures within this region, or it can be used to include both superficial and deep structures. The testes are oval-shaped, about 2 inches in length and 1 inch in diameter. Testes produce and store sperm and are an endocrine organ secreting male sex hormones into the blood. Sperm are produced and mature in seminiferous tubules and then enter the epididymis. The epididymis is an elongated structure on the posterior surface of the testes. New sperm are transported into the epididymis and stored there until mature. Seminal vesicles will lie between the bladder and the rectum, and a thick fluid mixing with sperm is secreted. At the time of ejaculation, sperm enters the vas deferens, and the vas deferens joins the duct of the seminal gland to form the ejaculatory duct. Male sterilization is a differentectomy, meaning part of the vas deferens is ligated or excised via an incision in the scrotum. This effectively prevents sperm from joining fluid from the seminal vesicles, prostate, and bulbourethral glands. The scrotum is a pendulous sac containing the testes, epididymis, and ductus deferens, holding the testicles outside of the body. Temperature cooler than the body is important in sperm production. When exposed to the cold, the scrotum retracts or shrinks, pulling the testes closer to the body. Warm temperatures will result in the scrotum expanding away from the body in order to lose body heat. The prostate is a walnut-sized gland inferior to the neck of the bladder and surrounding the urethra. It is a combination of muscular and glandular tissue. An enlarged prostate can block or impede urine flow. Location of the prostate close to the rectum is important clinically. An enlarged prostate can be palpated by a finger placed in the rectum through the anal canal, called a rectal exam. The penis carries urine through the urethra to the outside, and it is the male organ of intercourse. The body contains 3 columns of erectile tissue. The tip is the glans penis, and it is pierced by the urethra. The loose skin covering the penis forms a cuff around the glans called the foreskin or the prepuce. Male circumcision is the removal of all or a portion of the prepuce, exposing most or all of the glans. The nervous system provides three general functions: sensory, integrative, and motor. The nervous system helps us feel, think, remember, move, and be aware of the world around us. It is divided into two groups. You have the central nervous system and the peripheral nervous system. The central nervous system is the brain and the spinal cord. The peripheral nervous system are the nerves that attach the brain and spinal cord to the rest of the body. The cranial nerves will stem from the brain, and the spinal nerves will stem from the spine. The nervous system functions as a central operator and as the central intelligence for the body. It detects changes outside and within the body, makes decisions based on the information that is received, and then stimulates muscles or glands to respond. A nerve plexus is a network of intersecting nerves that combines spinal nerves that serve the same body area. The name of the plexus indicates the portion of the body that they serve. The brain is composed of the cerebrum, the cerebellum, and the brainstem, which is further divided into the midbrain, pons, and medulla oblongata. The cerebrum comprises the largest part of the brain, and it is divided into hemispheres that is connected by the corpus callosum. Cerebral hemispheres are made up of elevations and valleys, and your hemispheres are going to be divided into lobes, which correspond roughly to the names given to your skull bones. Each cerebral hemisphere has four major lobes: the frontal, parietal, temporal, and occipital. The front lobe is separated from the parietal lobe by the central sulcus. The gyrus just anterior to the central sulcus is called the precentral gyrus, and this is the primary motor area of the brain. The rest of the frontal lobe is used in modifying motor acts. Your posterior end of the brain is the occipital lobe, mainly concerned with vision. And then the cerebellum will protrude under the occipital lobe at the base of the brain, and it is primarily concerned with coordination of voluntary muscles. Organs of sense are classified as a subsection of the nervous system. The sensory organs receive and filter your sensory input that is interpreted in the central nervous system. Organs of sense will include your eyes and your ears. The eye is the sense organ of sight. The eyeball is made up of three layers. You have the innermost layer, which is the retina, the middle layer, known as the choroid, and the outermost layer is the sclera. The eyeball is separated into an anterior segment that is filled with the aqueous humor, and then a posterior segment filled with vitreous humor. The crystalline lens separates the two segments. The aqueous humor is responsible for the intraocular pressure within your eye. The vitreous humor will share the responsibility for the intraocular pressure, but it also prevents the eyeball from collapsing. One of the most common procedures on the eye is actually on the muscles that control the eye movement instead of the eyeball itself. That is known as a strabismus surgery, and that is performed by shortening or lengthening various muscles within the eye. The ear plays a part in both sense of hearing and the sense of equilibrium. The ear works in tandem with the auditory nerves to send auditory impulses to the temporal lobes of the cerebrum. These structures working together will form your auditory apparatus. The ear has three distinct and separate anatomical divisions: the outer or the external ear, the middle ear or the tympanic cavity, and then the inner ear or the labyrinth. The auditory apparatus uses the ear to capture sound waves and transmits or conducts them into the tiny hair cells in the organ of Corti. Your dendrites, or the nerve endings of the sensory neurons for hearing, will be found at the bottom of these tiny hair cells. The auditory canal, or the eustachian tube, will connect each middle ear to the throat. This allows easy transfer of infections in the throat to move into the ear, causing a middle ear infection. Children who have repetitive ear infections at an early age will sometimes have tubes placed within their ears. Otology is the study of the ear. This is a very specialized field of medicine, and you have two types of services: audiometry and surgical. Surgical services are often performed by an ENT physician, and then codes for procedures are typically found in the surgery section of your CPT codebook. Audiometry services are studies to test and improve your hearing. These codes for the services are typically found in your medicine section of the CPT codebook. The endocrine system is comprised of ductless glands where hormones are secreted directly into the blood, and then cells throughout the body secreting hormones and chemical substances that regulate our bodily functions, such as our metabolism, growth, reproduction, and water balance. Glands are organized aggregations of cells functioning as secretory or excretory organs. More simply, a gland produces a chemical or a hormone that affects distant tissues within the body. Hormones are chemical messengers. They are classified as either proteins or steroids. Your hormones will stimulate target tissues or organs by binding to cell receptors located either on the cell membrane or within the cell. The thyroid is located anteriorly in the neck on either side of the larynx and the trachea. This gland is composed of secretory units called follicles. Follicular cells will secrete T3 and T4 hormones, and those thyroid hormones have regulatory functions in metabolism and functioning in all other hormones, and they are required for growth and development. Your parathyroid glands are pairs of small structures that are deep and posterior on the lateral lobes of the thyroid. Essential for life, these parathyroids will regulate calcium metabolism that is so important in our muscular and nervous systems. In the fetus, the thymus is a large organ occupying considerable amounts of space within the thoracic cavity. It continues to grow until puberty, and then it decreases in size and is largely replaced by fat. It contains a large number of lymphocytes, and the cells produced are called T lymphocytes, or T cells, and it produces and secretes our hormones to control immune functions. The adrenal or suprarenal glands will lie on the superior end of each kidney. Their function is completely separate from the kidneys, and you have two distinct parts. You have the outer cortex and the inner medulla. The adrenal medulla will secrete epinephrine and norepinephrine, which are collectively called our catecholamines, into the bloodstream. These are also sometimes called our fight or flight hormones. The medulla is considered an extension of the sympathetic nervous system, and a tumor of the adrenal medulla is called a pheochromocytoma. The adrenal cortex, essential to life, is divided further into three distinct zones: zona glomerulosa, zona fasciculate, and zona reticularis. The cortex secretes three steroid hormones, which are lipid soluble and made from cholesterol. The cortex makes glucocorticoids, mineralocorticoids, and sex steroids. The primary glucocorticoid is cortisol, which affects our carbohydrates and maintains our blood glucose levels. Cortisol is secreted in times of stress, and it also affects our protein and fat metabolism for energy production. Mineralocorticoids will help regulate our blood pressure and concentration of electrolytes. Aldosterone is the primary mineralocorticoid, and its primary target organ is the kidney. Secreted sex hormones include small amounts of the female hormone estrogen and the male hormone androgen, which is primarily testosterone. The pancreas is both an endocrine and exocrine organ. The carotid body is a chemoreceptor monitoring the oxygen level within the blood. It is not an endocrine structure. However, it is listed in CPT with the endocrine system code set. The pituitary gland is about the size of a pea, located at the base of the brain. It is divided into an anterior and posterior lobe. The posterior lobe is attached to the brain by an infundibulum, and the anterior lobe has no direct connection with the brain. The pineal gland is small, cone-shaped, and above the cerebellum, and it's also close to the thalamus deep within the brain. It secretes melatonin, which is thought to play a role in biorhythms and the sleep-wake cycle, and it may be involved in other functions. The kidney, testes, and ovaries are glands that secrete hormones. These three glands are covered within other sections. The lymphatic system is part of the immune system. It runs through the body similarly to the way that the cardiovascular system does. The primary function of the lymphatic system is to transport lymph, which is a fluid that contains infection-fighting white blood cells or lymphocytes throughout the body. In addition to the immune functions, the lymphatic system is a network of tissues and organs that help rid the body of toxins, waste, and other unwanted materials by removing additional fluid from tissues throughout the body and absorbing and moving fatty acids. The spleen is an organ in the upper portion of the abdomen that is located to the left of the liver. The spleen is a blood filtering organ as well as a receptacle for red blood cells. It also plays a role in the immune system by producing lymphocytes that are involved in the infection fighting process. The immune system is classified as a separate system from the hematologic system. However, most immune cells originate within the hematologic system. Often, the study of allergies will go hand in hand because an allergic response is actually an immune response. The immune system is made up of two types of cells, B cells and T cells. B cells are created and mature in the bone marrow. They get activated and produce antibodies that attach to the surface of the infectious agent. T cells identify infectious agents and directly attack them. Both T cells and B cells are lymphocytes. Other types of white blood cells used by the body for protection will include neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Antigens will elicit an immune response in the body. Antigens that enter the body from the environment can include inhaled macromolecules, so for example, proteins on cat hairs that can trigger an asthma attack. Then you have ingested macromolecules, such as shellfish proteins that trigger an allergic response or a peanut allergy. And then lastly, you'll just have molecules, and these are introduced beneath the skin, such as a splinter or in an injected vaccine. Antibodies are immune system related proteins called immunoglobulins. Some antibodies will destroy antigens directly, and others indirectly by making it easier for white blood cells to destroy the antigen. Now that you are at the end of the lecture, you should understand the different word elements, different diagnostic and procedural terms, and then basic anatomy for each of the body systems. Don't forget to view the attachments and resources that are found within our module.